Dementia is not a disease in itself. It is a general term that refers to a decline in mental function severe enough to interfere with normal daily life. Dementia causes deterioration in various cognitive aspects, including memory, thinking, orientation, calculation, learning, and judgment. It is important to note that dementia is not a normal part of aging. While some cognitive abilities may gradually diminish during normal aging, dementia's impact is more severe than what is typically expected from aging. Dementia is a serious health problem because it directly affects a person's quality of life. It is also challenging for family members and caregivers. Approximately 10% of the population over the age of 65 is affected by some degree of dementia. Nearly 70% of these cases are due to Alzheimer's disease. The most common initial symptom of Alzheimer's is difficulty remembering recent events. Alongside memory issues, a person may struggle with finding words, visual and spatial abilities, and impaired reasoning or judgment. There may be problems with performing familiar tasks, such as cooking, managing finances, or using household appliances. The first-line treatment for Alzheimer's disease is acetylcholinesterase inhibitors, which increase acetylcholine levels in the brain, a neurotransmitter crucial for cognitive functions. These inhibitors can slow down cognitive decline but are not very effective, potentially preserving daily living activities for an average of 6 to 12 months. Alzheimer's disease involves irreversible damage to brain cells due to the formation of amyloid plaques and neurofibrillary tangles, leading to cell death. Alzheimer's disease reduces life expectancy by about 10 years if untreated. Treatment can extend lifespan by approximately 6 months. The severe stages of the disease typically develop 7 years after the initial symptoms. Vascular dementia accounts for around 15% of dementia cases. Unlike Alzheimer's, it is triggered by a stroke or mini-stroke, and symptoms often occur abruptly. It is characterized by fluctuating cognitive abilities, meaning mental clarity can significantly vary throughout the day. Depending on the location of the brain damage, specific issues such as weakness, paralysis, and speech problems may arise. Depression and anxiety are common during vascular dementia. The main mechanism involves blood vessel damage and restricted blood flow to the brain. Treatment focuses on controlling hypertension and cholesterol. Managing risk factors effectively, such as controlling blood pressure and cholesterol, along with diet and exercise, can stabilize the progression of cognitive decline for many years. Lewy Body Dementia, LBD, is another common cause of dementia, present in about 10% of cases. In LBD, Lewy body proteins accumulate in the brain, causing damage. Cognitive function in LBD can also fluctuate throughout the day. A hallmark of LBD is visual hallucinations, which are less common in other forms of dementia. These hallucinations may include seeing imaginary lines, grids, or intricate patterns on walls, or objects appearing much smaller or larger than they are. LBD typically progresses gradually, with worsening cognitive function, hallucinations, and motor symptoms over time. Cholinesterase inhibitors may offer some cognitive benefits. However, there is no cure for LBD, and it affects a person's lifespan by about 10 years.